Hi, my name is Dr. Andrew, and I'm a family doctor and osteopathic physician, and I own and operate Bayberry Clinic. It's a membership-based practice, direct primary care practice that offers white glove, concierge-style healthcare at an affordable monthly price. I just want to start by naming that most human beings desire health and wellness, and many humans in this modern time want to be told by a health practitioner that they are on their way to good health and wellness as well. And so, in the recent era of the industrial boom, many of that responsibility came down to the physician. So that's what I am. In the past, each physician was an integral part of their communities. They knew each patient's name, they knew what they did, they recognized, and was involved in the community life. And unfortunately, we don't live in those times anymore. Do these images look familiar to you? Um, 15 minutes is a standard medical visit time with a physician. Pharmacy lines are getting longer, and the process of getting meds that you need is getting more complicated. Doctors are looking at their screens more than you or your loved ones. Health insurance has become, health insurance has made navigating and getting healthcare a complex maze because by virtue of being health insurance, the financial interest isn't really in helping patients the virtue of being an insurance company. It is more interested in making money. And doctors are no longer able to remember their patient's name because they are responsible for up to 3,000 names. It's impossible to be an integral part of a community because of that. And doctors feel it. They're getting burned out because of it. And the way that we run healthcare right now is such that the only way that physicians are able to help the practice and the company make money is to have high volumes of visits. So that's why they're 15 minutes long without an ability to build a relationship anymore. So I'm here to bring the hometown doctor back and be the doctor that people can see when they need to, instead of going to an urgent care to see a stranger because their primary doctor isn't available for them, or to the ED because their primary care didn't have space to see them for an issue that could be taken care of, but the ED was the only option. By using a membership and direct care model where patients invest monthly in their health, anyone who becomes a member has access to a physician who is responsive, kind, interested in their lives, and knowledgeable about them specifically. So, what does a membership at Bayberry Clinic include? First, an open channel of communication where members can text, call, secure message at any time, and it will go directly to me, your doctor. And next, no additional expenses for visits. Whereas in many insurance plans, they charge a copay or they charge something for each visit, it's all covered in your membership. This reduces the uncertainty of cost and any surprise bills. And within these four walls of my practice, there are no surprise bills. If anything, it does have a cost. It does get discussed upfront, and there's a hassle-free process of taking care of that instead of waiting 3 months to know what it actually costs. And speaking of costs, while I can send prescriptions, labs, imaging, referrals to providers that can still bill your insurance, your health insurance, I am able to tell you how much any lab, med, imaging will cost right out the gate, which prevents leaving you in suspense wondering if something was covered or not, or if you'll get a bill later. Having cash pricing is also an excellent way to support patients who are struggling to find health insurance. If you are uninsured, having a cash price may just give that extra comfort of knowing that you're getting the service that you need and deserve at a cost or at a price that you can afford without accruing other bills that will come your way if it gets processed through their practice, through other practices. And as you can see in these pictures, and I'll move maybe more to the center here. Nope, I can't. Okay. Um, in my practice, I draw your labs. I can dispense meds from my own Bayberry pharmacy at a fraction of a cost of a typical drug copay. I'm able to get the price down to anywhere from 3 to 4 cents per pill. I can perform EKGs. I have my own EKG machine. I am able to give injections, joint or otherwise, not vaccines at this point, but if you have a migraine, I am able to give a Toradol shot. And if you have any long-standing joint problems that you have had injections for, I'm able to help with that too. And I can do so much more. This is beyond what many standard primary care practices can do. And it's all because I know that people deserve this kind of attention and commitment to their health. People deserve to know that as a health provider, I'm interested in them and becoming, and I want them to be the healthiest that they can be. Um, the last part, which I think is most significant, my intake visits are 90 minutes and my follow-up visits are 45 minutes. We may not take up the entire time, but I want to make sure we have that space because this is the time that that would be required in many cases to truly get to know you, what your challenges are, and to have a concrete way of taking next steps to better health. There are already members within Guilds with Benefits that have benefited from the unique way that Bayberry Clinic cares for you and the members. And among them are a few stories that have come through for me and really resonated with me. And these are a mix of other kind of patient profiles, but I wanted to at least give an illustration of what has already happened within the last week for me in this practice. Um, so one story, a patient was starting a new relationship with a partner, and they were worried that their oral herpes, genital herpes, would be transmitted to the new partner, and was having a hard time finding care. And so we were able to develop a plan to have them take an antiviral whenever the flare appears, and doing that will keep the lesions from transmitting to the partner. Another story, another patient was having so much work and parenting stress and burning out that they were having cardiac symptoms and heart racing. And we did an EKG tracing to show that her heart was actually normal, but also we were able to review red flags for when it was appropriate to go to the emergency room to have that kind of education and that touch point and follow up. And lastly, yet another patient was struggling to find primary care provider, and they were surprised when they moved here that the amount of time that it was to see a new one was about 6 months. And because they had a complex drug list and had specialists from out of state that manage some really complex issues, um, I I could assume that it would have taken them a long time to really establish with the care that they really needed and deserved. And one of the medication was Ambien, which I was happy to prescribe because, I knew that they were on this for a long period of time and long term. But good luck having any typical primary care office write that prescription without having you jump through a lot of hoops to document and make sure that there's proof of any kind of communication. I trust my patients, and I hope they trust me. In a standard 15-minute appointment structure, the provider isn't able to hold space for the anxieties and worries. And as a result, these patients would have felt ignored, dismissed, and even had their problems minimized because of the limited space that there is to explore these things. And for that reason, this is why primary care has to do better, and I believe it can. This is me. If any of this resonated with you, I would love to connect and speak to you. I offer meet and greets. I offer, if you want a one-time appointment, my website links to a link to be able to give them to you. And within your Guilds with Benefits profile and is it the client portal? Within your portal, you're able to access an acute care visit with me and schedule one with me for $120. It's a special rate that's only for Guilds with Benefits members. So the flexibility of a cash-based primary care practice makes it remarkably simple for you to get the care that you need and deserve. I want to make sure I tailor it because some things were from my previous presentation. So if you're someone like this, I would love to talk to you. If you have any concerns about your health or having trouble managing chronic conditions because it's so hard to see your doctor, I want to talk to you. If you're curious about where you stand health wise, you want to have some baseline labs and really just kind of see if you are on the right track with your body, mind, and soul, I'm here for you. I want to truly be your doctor, and I want to navigate your health journey with you. And that's what fills my cup. That's what I love to do, to see that you're the best that you can be.